Good evening, everyone. My name is Dr. Andrew Lee. I'm a neurologist and also a concussion specialist. This evening I will be talking and hopefully educating you about concussions, traumatic brain injury, and this concept of chronic traumatic encephalopathy. Hopefully by the end of this talk you'll be able to understand what a concussion is, what the different types of concussions are, what to do for you or your child if someone to have a head injury, and then subsequently who you could call for help. So we'll start the talk now, and then I'll follow up with any questions at the end of the conversation. So a concussion and a traumatic brain injury, or TBI, is used interchangeably. As a doctor and kind of in the medical field, we like to use the term TBI, and then we could also grade it as mild, moderate, and severe. So what is a concussion? So really a concussion is a brain injury. So some type of energy that's transmitted to the head that causes some type of dysfunction in terms of the way the brain operates or the way the brain functions. Now, a common myth is that you have to have a direct blow to the head to have suffered a TBI or concussion, which is not true. So you could have a blow to the body, a blow to the neck, or even not any blow at all. So for instance, you could see that veterans coming back and they have these weapons and these bombs that explode, and there's this sonic energy that gets transmitted to their head, and that can cause a concussion or brain injury. Most of the time, if the concussion is mild, it results in kind of a short-lived dysfunction where the brain is just not operating normally. And it could last for several days to weeks depending on the severity of the injuries, but most patients will recover completely. Important to distinguish is that a concussion is what we call a functional disturbance. So it affects the way the brain works, but it doesn't affect its structure. Why that's important is because that if you take a picture of the brain, for instance with a CT and MRI, the picture will look completely normal, but your brain may not act normal and you may not feel normal. And concussion in general is graded on different sets of clinical symptoms. So a couple myths to understand, and this is something that's kind of evolved over the last several years to decades. And the science is still catching up and trying to educate the general public about what a concussion is and what to do when you have a concussion. So the first thing, and this has been a long-standing belief, that you have to have lost consciousness. So you need to be quote-unquote knocked out to have a concussion. And we all know that that's completely not true. Actually, if you get knocked out, that's a pretty severe concussion. So any type of energy that gets to your head that causes your brain to not function properly, you could be diagnosed with concussion. The second that I mentioned before is that you have to have a direct impact to the head. And that's not also true. It could be impact to the body, to the neck, that transmits dispersive energy to the brain that causes the brain to rattle. That can cause a concussion. After concussion, you have to keep someone awake to see if they're okay. The most important thing if you have a mild concussion is to get rest and sleep. So waking up a person over the course of the night to see if they will wake up is actually detrimental to their recovery. If you don't have symptoms immediately, you don't have concussion. A lot of times concussion symptoms are delayed by several hours, by even several days. So symptoms aren't always prevalent and obvious in the beginning. It's only with time when you start developing symptoms. Myth number 5, you can return to play as soon as you feel okay. That's absolutely not true. The brain needs time to heal. So there's a graded set of symptoms and then a graded set of return to play protocol that we know that your brain is healing in the proper and timely fashion before it's safe for you to go back and doing what you need to do. And then myth number 6, everyone who with a concussion needs an MRI or CT scan. So we talked about that the concussion is a functional injury, affects the way the brain operates, not necessarily a structural injury where the structure of the brain becomes deformed. So most of the time a CT and MRI would not be helpful in diagnosing concussion, and you don't need to expose yourself to any unnecessary radiation, especially for the CT. So what is concussion? Really, It's a direct or indirect injury to the head that causes the brain to function improperly. Traumatic brain injury, synonymous with concussion. So a mild TBI is similar to concussion, and then there's moderate and severe, and we'll talk about how to grade those. And then chronic traumatic encephalopathy, CTE. These are the ones that you're seeing with football players, maybe committing suicide in the movies. This is an entity where you have repeated head injuries over the course of the time. It causes the brain to degenerate, and it causes a severe set of neurological symptoms. So traumatic brain injury can be segmented in three levels of severity. Mild, which is a concussion. Generally, the symptoms last from 0 to 14 days, so up to 2 weeks. Most patients with a mild injury, about 80 to 90% of patients, will resolve and recover. There may be a longer time frame for children and adolescents, and that's because the brain isn't fully myelinated or fully developed, and thereby it's not protected yet in terms of when the brain is rattled or there's some type of energy that gets transmitted to the brain. Moderate, where the symptoms last longer or the symptoms are more severe, and this could last for anywhere from 3 to 6 weeks. This is also synonymous with a post-concussive syndrome, and about 15% of patients who have a moderate TBI or a TBI will land in the moderate stage. And then the last one is severe. This could be lifelong, years, and it could cause significant disability, headache, dizziness, memory problems, cognitive impairment, behavioral challenges, mood disturbances. And this is when you have a severe head injury where there may be bleeding, this may be a severe car accident, and so forth. There are many causes of traumatic brain injury. So the one that we tend to focus, especially in the adolescent stage, is sports-related injuries. But TBI can occur in anyone at any stage in their life. So it could be from falls, and the falls are kind of bimodal in distribution, where we have the elderly population. They're more prone to falling and slipping, and also the pediatric population, so generally the younger than 2. In the mid stage, when you're in your teenage years and in your 20s and 30s, assaults and motor vehicle accidents are very frequent. And what we know is that there's a clear increase in TBIs in the general population. We could speculate that that's maybe from just being more active, or we're engaging in activities that would pose to hit our head and injure our heads further. And also kind of what we're doing today, in that we're educating the community. A lot of concussions or TBIs in the past have been underrepresented or underdiagnosed because people just didn't know that they had a concussion and didn't seek medical help. So there's a clear underdiagnosis, underrepresentation in the previous numbers, but it's starting to catch up with kind of events like this where we're educating the general public about head injuries, so people are more aware, parents are on the lookout, and they can get the proper help when needed. So when someone has a head injury or concussion, what are the symptoms? The symptoms with concussion can be vague and nonspecific, and that's why it's somewhat challenging to diagnose. Unfortunately, there's not a single test to say you've had a concussion or not. There's not a blood test, there's not an MRI, there's not some type of EEG, a brainwave activity test to say yes or no. And so there are a lot of companies and technologies trying to develop this, but still at this point it's still an inexact science. So you could feel just different. So you could have amnesia, problems with memory, mood. You may be a little bit dazed or stunned. You could be a little bit more confused, clumsy. Your balance is off. You may feel dizzy. Your focus and attention may be off. You may be more irritable. Your mood or personality or behavior may be a little bit off. You could have physical symptoms. You could have headache. You could be nauseous. You want to throw up. You may have balance problems. You may have double vision, problems with focusing. You may be very sensitive to light or noise. You could feel just off. There could be a lot of other symptoms, like you just feel a certain sense of anxiety for no reason, even though you're not an anxious person. You just don't feel right. Concussion symptoms go in 4 general categories. So they're physical symptoms. So the symptoms that we talked about before: balance problems, headache, neck pain, blurred vision, loss of consciousness. Emotional symptoms: you're more irritable, you're nervous, you're anxious, you're more emotional, you may be crying for no reason, you may be sad, you feel like you're in a fog or a daze, you just don't feel right. Cognitive symptoms: your thinking is impaired. The best way to look at it is that you're just not operating normally. You have difficulty remembering. You may be a little bit confused. You may be drowsy. It may take you a lot longer to do a task. You are unable to multitask. And then sleep. You could have problems sleeping. You could have significant sleep disturbance. So you may be sleeping too much, sleeping a little bit too little. Your sleep quality is very poor. So when you have a concussion or head injury, there are several ways to kind of assess it. So one is a really quick run through the CDC form, which is called the ACE Concussion Evaluation. And on this slide, you see that there are graded symptoms in terms of the 4 categories that we talked about. So there are the physical symptoms, cognitive symptoms, sleep disturbance, and emotional symptoms. And then you would say yes, and then you would give it a 1. And then if you don't have those symptoms, you have 0. And then we quantitate what your score is. We use this as a baseline to kind of get you back to normal. There are other tests out there. So there's impact testing, which is cognitive test. And then there's a test that's probably most widely used, and that's the one that I use, called a SCAT-5. This one is done by an international body of concussion sports experts. This is used in many of the professional sports leagues, and this has both these clinical symptoms that one may experience, and then also on the field and physical evaluation. So the SCAT-5, I won't go through too deep in details, but one of the things I want to highlight is red flags. So one of the most common questions I have is, okay, my son or my daughter has had a head injury. How do I know, or when should I bring them to the ER? So red flags is something that you should note to give you a quick screen or triage to say this is something that's really concerning, that they need to go to the ER immediately, or yes, they have had a mild TBI or concussion, and make an appointment with your doctor the next day or the following day. So the red flags: if they have significant neck pain or tenderness, if they can't see, they have problems with their vision, problems focusing, double vision, any type of weakness or numbness, tingling, particularly in the arms or legs. The headache is severe, not just a mild, dull pain on one side or the other. Anyone who's had a seizure or convulsion. Loss of consciousness. We mentioned before, one of the myths was that you have to have loss of consciousness to be diagnosed with a concussion. No, when you have loss of consciousness, that means that it's a quite severe head injury. They need to be evaluated in the ER. If the mentation, the level of consciousness is fluctuating, they may be more alert, less alert, if it's deteriorating, you need to go to the ER. Any type of vomiting, not just nausea, but when you're frankly vomiting, you need to come to the ER. And then if your son or daughter or family member is restless, getting agitated, getting combative, those are all red signs that you need to bring them to the ER. And these are more concerns that this may not just be a mild TBI, but something more mild, severe, or perhaps a brain bleed. So I'll skip this next slide and let's go to neuroimaging. So neuroimaging is important because we talk about CT scans and MRIs. A lot of times patients that come to see me in the clinic, they always ask about getting a CT and MRI, and we know that most times, I would say 95, not 99% of the time, a CT or MRI is not needed and is not helpful. It does not rule out a diagnosis of concussion, or it does not rule in a diagnosis. And we don't want to expose, especially younger kids, adolescents, to unnecessary radiation with the CAT scan. So as a doctor, there's a criteria that we also use to say who needs a CAT scan. And this is kind of similar to some of the red flags that would bring a patient in. So this one is a Canadian CT head rule. And I think this is very important, not just for clinicians, but just a general idea in adding to these red flags in a more technical term. GCS less than 15, so this is what we call a Glasgow Coma scale in terms of the level of alertness, their eye movements, their speech. Is there any type of open injury, an open fracture, depressed skull fracture, any type of a basilar skull fracture, so a black eye, blood underneath the skin, either in the ear or beneath the eyes, vomiting. Anyone who's more than 65 should probably be brought in. If someone is amnestic, can't remember what happened and why they're there. If the mechanism is dangerous, so being hit by a car, being ejected during an accident, falling more than 3 feet or more than 5 stairs. If you have some type of neurological deficit, weakness, numbness, can't walk, a seizure. So this may be a little bit more complex for the general population, but this is also helpful in saying when you need to bring someone to the ER. So after a concussion, especially if you've had a mild TBI, 90% of patients will recover within 2 weeks. So how do we graduate someone? How do we accelerate their recovery? So after the injury, 24 hours of rest and relaxation. You don't do anything. Don't continue in terms of school activities. Don't continue in physical activities. Just eat light meals if you're not too nauseous. Get some sleep and get some rest. After a 24-hour period of complete rest, then we followed the CIF return to play protocol. So in this is what the CIF has conducted and recommended and actually mandated by California law in terms of everyone needs to see a physician to return to play and get cleared before you run back to your sports. So the CIF protocol says, okay, so stage 1 is the first 24 hours of rest. If you pass through that without any recurrence of any symptoms and you're feeling okay, and you go to stage 2A where you have light aerobic exercise. That might be a little bit walking, might be a light stationary bike. If you're doing okay after going that, the next level would be moderate intensity. So 20-30 minutes of jogging, maybe light weights, and then so forth. So you have to go through each one of these stages. Each stage takes 24 hours for you to clear before you go to the next stage. So it's not like you go to stage 2A, you're doing fine. In the next 15 minutes, you go to stage 2B, and so forth. Finally, if you've passed each stage, then you go to limited contact, and then full contact, and eventually full return to play. Each of these takes 24 hours. So if you go through stage 1, 2, 3, 4, 5, this will take at least 5 days for you to pass. Anyone who's clearing you in less than 5 days is actually violating California law. This has to be done with the assistance of a medical professional, whether it's your athletic trainer, your physical therapist, or your physician. If we talk about people who have problems persistently, so the moderate TBI or those who have prolonged symptoms going beyond 2 weeks, there is no treatment for brain injury. It's a matter of time, letting the brain heal, letting the brain rewire. So for some people, it may take several weeks. For some people, it may take a lot longer. So as a medical professional, as a medical team, you may need assistance with your symptoms as your brain recovers on its own. So one is you have cognitive symptoms. You have memory and processing speeds. So we test for your cognition. We see what your linguistics abilities are. We may need a bigger battery, more comprehensive battery, neuropsychiatric testing to see where you are, and then assist you in those areas that are deficit. Emotional symptoms. One of the biggest symptoms of concussion is anxiety and depression. So we want to manage that properly. You may need psychotherapy. You may need some medications to kind of stabilize your mood. You may need cognitive behavioral therapy. The physical symptoms. This is where the big symptoms and a lot of patients have. This requires vestibular therapy, physical therapists, occupational therapists, speech therapists, optometrists. All these people to kind of help recalibrate in the way you walk, in the way your balance centers are, in the way you think. And then kind of to help with other things like headache. If you're having a lot of headaches, we manage you with kind of migraine-like medications to kind of get you over the hump and make you feel better, manage the headache better, so your brain continues to heal. Sleep. Your sleep can be very fragmented, can be very poor. You're not sleeping enough, or you may be drowsy, so we help and guide you and advise you in terms of getting you better sleep habits. And then most importantly, kind of overall education, walking you back to return back to life, return back to play, and allowing you to resume the life that you had before. So I want to touch a little bit based on chronic traumatic encephalopathy. This is when someone has repeated head injuries over the course of their lifetime. And this doesn't always need to be these big hits, these huge concussions. It could be these micro subconcussive hits that occur all the time. And what happens is that this causes the brain to degenerate and not recover. So this is an irreversible process where it causes a lot of brain dysfunction. If you look at the basic structure of a brain cell or neuron, we have the cell body, followed by the axon, which is kind of the communicating wires that send the signals to different parts of the brain and different parts of neurons. So when the brain is working properly, you have this myelin, and the myelin is this sheath, kind of the conducting material, which helps speed up the communication and the signals. When the myelin is disrupted or poorly formed or not yet formed, for instance, in adolescence, the recovery can take a lot longer. So when you have a brain injury, so when these nerves and these ropes of lines of communication are shaken, there are little pieces of scaffolding or kind of glue, what we call microtubules, that keep the structure together. If you keep shaking it, if there's repeated head injuries over time, the scaffolding or this glue kind of breaks apart. And one of the proteins that keep this glue together is called tau. When the tau gets broken apart, it starts clumping together in the brain. And when it clumps together, it causes these tau proteins. And over time, these tau proteins cause degeneration of the surrounding healthy brain cells. So what are differences in CTE versus having a concussion? So CTE is similar to dementia, similar to Alzheimer's, in which you may have memory loss, you may have mood swings, you have difficulty in concentration and focus, and you have changes in behavior and personality. And this is not a temporary thing, and this is not a transient thing, this is a progressive thing, that it starts and it continues to maybe get worse. Unlike dementia, features of CTE is that there's more mood instability, there's more behavioral problems, there may be angry, there may be emotional changes, lack of impulse control, they're disinhibited, they may have other things like tremors, problems speaking, problems walking. CTE, if you have repetitive head injury, can occur much earlier than someone with dementia. So for instance, in their 40s. The buildup of this tau protein, the scaffold, this glue that keeps the microtubules and the wires together, it destroys the brain tissue and the cells. And the more tau you have, the worse your symptoms are, the earlier your symptoms are. But it's still unclear. There are people who have years of head injuries, years of head impacts, and they don't necessarily develop CTE. So there are probably multiple other risk factors that we have yet discovered that maybe some people, for genetic reasons, are less prone or more protective to head injuries, and some aren't. The only way to really diagnose CTE is by autopsy, taking a slice of the brain, looking at it under a microscope. So these are some slides of brains and then microscopic histology of it. So you see on the left kind of normal, there's no staining. When you see good, healthy brain cells. Someone who has mild CTEs, you're starting to see some of the brown stains, clumps of these tau proteins that are accumulated inside the brain and next to normal, healthy cells. And then severe, as you can see, the brain tissue, the brain volume is severely atrophied, and the clumps of protein and the staining of the tau is all over the place. So what are some risk factors? So One is that the age of the first exposure. So the younger you are, and we talked about kind of the myelination and the development of brain, the higher your risk of developing CTE. And then how long you've done it. So if you've had a long career of boxing or playing rugby or football, the longer your career is, the higher your risk is. One concussion generally does not cause CTE. It's generally repeated hits over a long period of time. And these hits don't have to be these large hits that you see highlights on ESPN or anything like that. These could be small subconcussive hits where you may not feel anything. And so in football, the linemen are most prone to CTE because on every single play, they're having these subconcussive hits that accumulate over time. So in summary, what is concussion? Concussion is any type of energy force that gets transmitted to the brain where the brain is shaken enough where the brain cells are not functioning normally. This is generally a transient thing where you may have a greater set of symptoms in the 4 general categories of physical symptoms, cognitive symptoms, emotional symptoms, and sleep-related disturbance. TBI is synonymous, or mild TBI is synonymous with concussion. And we grade a TBI in 3 levels, mild, moderate, and severe. And then CTE is repetitive head injuries that may be subconcussive, meaning that you don't necessarily feel anything or feel any different after that one, but then they accumulate injury, they accumulate that tau protein over time that causes very similar symptoms to dementia, except the symptoms are more severe, especially the mood and the behavior and the personality changes, and it occurs a lot sooner. So that concludes my talk. Are there any questions at this point?
Yes, we actually have a 3-part question.
Okay.
The first question is, are there any new treatments that you believe are effective for PTS? For example, virtual reality for eyes and stimulation are advertised as being highly effective for PTS.
So I think that this is a gray zone. It is somewhat exciting that there are a lot of people who are looking into this, both scientists, people from the physics, people using technologies, and then there's a lot more funding. So the Department of Defense, where they're worried about the veterans coming back, they're pouring billions and billions of dollars in terms of trying to find solutions to help people who've had head injuries. And so as a neurologist, as a doctor who takes care of a lot of patients with concussion, I have to kind of sort out the weeds. And sometimes these technologies or these new novel techniques are coming out faster than what we can vet them and saying that, well, this works, this doesn't work. And so one of the things that I have to be careful with is that I don't shut down potential new therapies because there's not data to say it works or it doesn't work. So for prolonged post-concussive symptoms, one of the things that I think can work is virtual reality. So virtual reality is really kind of helping in a simulated environment. And so whether it means kind of calming the nervous system down, helping with anxiety, helping with kind of pain, that I think holds a lot of promise. The other thing in terms of tongue stimulation, I don't know anything about tongue stimulation. There is a nerve called the trigeminal nerve, which provides kind of sensation in terms of different arms or different aspects of the face. And that nerve has a lot of pain fibers, and it causes a lot of pain in people, and it's one of the generators of migraines, TMJ, and so forth. There are technologies in which kind of neuromodulation and where that particular nerve is stimulated to different frequencies and different wavelengths that has shown some promise in terms of helping alleviate pain and migraines and potentially even seizures and epilepsy. But in terms of concussion or TBI itself, I'm not aware of any good data to suggest that is beneficial.
And then the other question is, can PCS lead to vestibular issues? Anything you recommend for vestibular issues?
So absolutely. So vestibular issues, So I would look at it as is a kind of a triangle. Okay, so the eyes, the ears, the inner ear particularly, and the back of the brain called the cerebellum are finely calibrated to help you kind of get your sense of position in your environment and in space. When that's disturbed, it needs to be recalibrated. So there are certain exercises and techniques in terms of helping kind of with your gaze, with your eye movements, certain exercises to get your inner ear properly in balance. And so many patients who have a head injury have dizziness, have problems with focus, have problems moving their eyes, have problems looking at certain things. So vestibular rehab is an essential part of your recovery. And there are many places that do it well. Some physical therapists don't do it or don't do it as well. So if you're in that stage where you have prolonged post-concussive symptoms, you want to go to a physical therapist where they focus and they are experts in terms of vestibular rehab. And if you need help, you can reach out and we can give you some referrals. Okay. Thank you for signing on and thank you for watching this video. We here at Hoag are continuing to improve and expand our concussion program. So one of the things that we have restarted is the concussion screening clinic. So that's in the 510 Superior Lab in the PT office. If you are involved in any type of sport or any type of activity where you may have or you potentially could hit your head, you want to get a screen. And what that screen does is that if you were to have some type of injury in the future, we could compare what your cognitive assessment is, what your reactivity time is, what your symptom grades are, and compare it to how you were before, because everyone's different. Everyone has different baselines. That way, we could properly and walk you back to your normal self in a more refined manner, as opposed to just assuming that this is how you were normally. So we could also provide phone numbers. The clinic is open for business now, and anyone who's involved in any type of activity where they could potentially hit their head, please come visit us. Thank you.